in progress. I'll let you know when it starts. Okay, we're live.
Okay, everyone, I'll call the meeting of the neighbors of Dunn County to order. Let the roll show that all members are present along with Chairman Bartlett. We all should have had a chance to check the minutes prior to the meeting. Is there any additions or corrections to the minutes? And hearing none, is there a motion to approve?
So moved.
Motion by Supervisor McCullough. Is there a second?
I'll second.
Second by Supervisor Jensen. All those in favor say aye.
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 Opposed? Carried. No public comment. We'll get into Carmen's administrator report.
All right, thank you, Chairman Johnson. Originally on my report today, the first item is the introduction of my administrator in training. So as I mentioned last meeting, we have an administrator at training at the Neighbors. Her name is Brittany Johnson, and she's on this call today. I'll go over a little bit about what an administrator in training is. Brittany will be with us for about a year. For the licensure of an administrator in the state of Wisconsin, they have to have a training program that is 2,000 hours or more. So the minimum is 2,000 hours of learning in a long-term care facility to sit for the licensure board examination. So Brittany will learn from all of the different department heads at the Neighbors as well as myself. She spends about 6 months doing rotations through all the different departments. She'll be with dietary, nursing, social services, activities, business office, all the different parts of a nursing home. And then also be with an assisted living in town as well as home health care and hospice. And then through this process afterwards, she'll also do a significant project that will benefit the nursing home and as well as help her learn how to project manage and then also take that skills with her in her future career. So we're excited to have Brittany here with us, and this is her first official meeting. So she is on board with us today.
Welcome, Brittany.
Thank you.
Welcome, Brittany, and condolences. Good luck.
All right, and then secondly on my report is the Quality Assurance Steering Committee updates, as always. This month we talked a lot about COVID-19 as we have for the past few months. It's kind of been the topic of everything. So we discussed the different changes in that as well as testing, which I'll get into a little bit later. We also talked about flu shots, which has been an ever-changing dynamic of when we give flu shots. So we gave them last week for most of our residents, and then we'll be starting tomorrow giving them to staff. It goes back and forth if you should give them earlier versus give them later. Dr. Brown gave us the go-ahead to start giving them. To date, I think the majority of our residents have gotten their flu shots, and then we will start with staff tomorrow and through the next couple of weeks to make sure all staff get flu shots. We are intrigued to see how many staff get them this year. Part of the reasoning is because we have everyone wearing masks already, and that's typically what we do if someone refuses a flu shot, is they are required to wear a mask through flu season. So now that we're all wearing masks throughout our day anyways, it'll be interesting to see how many staff really do get the flu shot, because part of the deterrent of not getting one is wearing a mask, which we're already doing. So we did discuss that during quality assurance. And then as always, our falls and wounds and infections, which have all stayed pretty consistent, no spikes or any outliers there. We also talked about eye wash stations. We will be adding more eye wash stations to our households and the safety part of things for staff. We realize that our eye wash stations aren't as convenient as they maybe should be. So we are adding them into the household sinks. So our maintenance team and safety committee are working on that. Any questions for quality assurance? Okay, the next item is employment activity report, and I'll refer to Chris for that.
Hi, can everybody hear me?
Yes.
Okay. So in your packet, or I would have sent it out after the packet had come out when I got the financials, is the report. So the types of recruitment is still pretty much the same. The nice thing that NeoGov does is, which is the new software for onboarding that the county is using, it also feeds Indeed. So that's been very nice. Which you can kind of see in the next line for the referral source. The website has actually gotten us more referrals than positive word of mouth, not, by about 3 applicants, which was nice to see. So for the month of September, we had 14 interviews scheduled. We actually held 13 interviews. So we offered, out of those 13 interviews, 11 positions. Or 12 positions offered and accepted were 11 positions. And 1 position was accepted at higher than a step 3, and that was a registered nurse. So we'll skip down to the resignations. So we did have our typical turnover. We had 1 CNA, part-time CNA that had retired. 1 part-time CNA went to Mayo. She went to Mayo because she is in the physician assistant program or pre-physician assistant and wanted a different type of service or experience. We had 1 full-time CNA quit. She just said that she was done with healthcare and left. We had a part-time homemaker that went to the Walmart distribution center. Another part-time homemaker went to the school district. We had a part-time RN accepted employment at Mayo. And then we had a full-time RN who left, just wasn't a good fit. She had some personal issues. Down to open positions, so those have been adjusted. You will note we have all the homemaker positions filled at the moment, so that's a good thing. Go down to leave of absences, and I think I had mentioned last month that our leave of absences would take an uptick with students returning back to school. So we did have 8 education-related leave of absences, along with our normal leave of absences. We did have a couple of full-time CNAs out on FMLA for themselves for medical reasons. And there's a couple of homemakers that were out, or 1 homemaker that was out, an LPN that was out. And then we had a part-time CNA that's on military leave. If we go down to the work comp lost hours, for September, we did not have any lost hours, nor did we have anybody on a restricted duty type of a situation, which is very positive. And that's been kind of that tally, or that total for the work comp has been running like that for a couple of months now, which is very nice to see. Does anybody have any questions on that, or?
All right. So then we'll move on to the referral activity
good.
report. Oh, sorry.
Okay, never mind.
Okay, we'll move on to the referral activity report for September. So we started out the month with 114 residents. We had 40 referrals. 7 residents were admitted to the neighbors during September. This is primarily because we had an outbreak in September and the central building could not accept admissions. So all of those admissions were tracked, but per public health, during an outbreak of COVID-19, we are not able to have admissions to that neighborhood. We did admit to our outer buildings during that time, but fortunately and unfortunately, they were full for the most part, so there wasn't much room to admit. So we could not take very many admissions. We kept those 2 buildings completely full, but then they were not able to admit to the central building due to public health concerns. That outbreak lasted for the majority of September. It started over Labor Day weekend. It was that 1 nursing student that tested positive that we had talked about last month, but we were not able to admit during that time. So those 40 referrals, we were not able to take very many of until the end of the month, which we were out of the outbreak, and that's where we get those 7 admissions from, was post-outbreak. We had 33 not admitted from that. Reasons to not admit or where they went instead, primarily they were all denied due to not being able to take admissions, but we still tracked where they went. 16 couldn't go because of precautions. That was what I was talking about. 1 was a person that had COVID positive. 4 went to their first choice, 3 of which were swing beds, and 1 was Sacred Heart Rehab. 1 was no insurance, 6 behavioral issues, 1 passed away at the hospital, and 4 residents went home from the hospital. At the end of the month, we had 111 residents in the facility, zero transferred to another facility, 4 passed away, and 6 discharged home. As you can see, that is a huge dip from where we are normally at. Fortunately, we are working our way back up, but it has been very difficult since we had quite a long time that we could not admit residents to the neighbors. It was about 25 days that we didn't admit to the neighbors due to the COVID outbreak. So that was a big hit, but we are working our way back up. All 3 of our buildings are able to accept admissions at this time. So we are getting there. I know we do have several coming in this week. As always, our referral sources are the same: Mayo in Eau Claire, Mayo in Menominee, and Sacred Heart in Eau Claire. Those have stayed pretty steady as well. Any questions about referrals or admissions? Mike?
Oh, yeah, thank you. Could you explain a little bit, please, just when or what triggers that we can't accept people
Sure.
for COVID?
Yeah, so we have anytime that we are in an outbreak status. So if we have a staff member or anyone who had been in the building test positive, we go into an outbreak. And that was that student nurse that we had talked about last time had put the central building into an outbreak. Per public health, when you are in an outbreak, you cannot accept admissions to that building. It is something that was originally, when we were in the outbreak, it was actually a county by county decision based on public health's decision. And then in the midst of our outbreak, it actually became a state policy to not allow admissions during an outbreak. It has since been altered a little bit to be only to not allow admissions during an outbreak to a specific wing or unit that that person worked or lived on. So now if we have another outbreak going forward, it would be less restrictive. But during this time, it was at all because it was the original memo. But then there was quite a bit of pushback from facilities and hospitals, for that matter, to not have it be as restrictive, because not allowing admissions also backs up the hospitals even more than they already are. So going forward, we'd have less of restrictions on this. But when we were in the outbreak, it was a memo that said we could not have admissions.
Okay, thank you. And how long does an outbreak last then for something like that?
So in the eyes of public health, an outbreak is 28 days past your last positive case. So when we started on the 6th of September, so it would have been 28 days after that. For the new memo that came out, if you're testing your residents and you have residents and staff and you have 14 days without a new positive, then you could accept admissions. But at that point, it was the 28 days.
Thank you. That explains it really well.
Anyone else have any other questions about this? All right. And we'll move on to the environmental and facilities report with Scott.
All right. Nothing real exciting going on as far as in facilities and environmentals. I've been working on work orders, repairing equipment, and in the building. The typical minor breakdowns on dishwashers has been an issue. But we were working through that. The guys are getting pretty good at diagnosing and replacing parts on those. We had reported that we had our server update done on the nurse call system. I'm working to get remote access for Kurt from RF Technologies so that it'll be a faster turnaround on any problems we're having with it. So some issues have come up with the new servers, and with him getting remote access, it'll be a lot smoother transition getting those bugs worked out. Other than that, starting to prep for winter. They're saying their first snow could be this Saturday. Not going to stick yet, but it will be coming soon. So we'll be prepared for that. That's all I have.
Is there any questions for Scott at all? All right, I'll move on to COVID-19. So I just have a couple of updates from the neighbors' perspective of COVID. The biggest thing that we're dealing with right now is staff testing, general screening testing that we are required to do per CMS with the federal government. We are required to test based on our county positivity rate. As you are all well aware, Wisconsin as a whole, as well as Dunn County, has had huge increases in COVID-19 out in the community. So we are now above a 10% positivity rate in Dunn County, and we have been for a couple weeks now. It means that we are required to test twice weekly for all staff. That is a huge undertaking. We have about 200 staff if you include our therapy department, maintenance, any maintenance team that come into our building are included in that. So Scott's whole team comes over twice a week, all of our therapists, agency staff, our staff. So we're testing about 200 people twice a week with our point of care testing. It is an on-site testing system that it's a little box about this big handheld size that we do testing on. It's right on site. It takes about 15 minutes to get the test results back. So we're working on that. Takes quite a bit of staff time. So we did have a nurse that is a new hire nurse that was willing to do testing for us. So then we can also hopefully code all of her hours to COVID funding as well as we do need to enter in all of the results into the WRL, which is the reporting system for labs in Wisconsin, because now we are a lab. We're using our CLIA waiver to do tests ourselves instead of sending them out. The other thing with this is that these tests do have a slight error rate. The negatives are negatives, but there is an error rate on the positives for these tests. So anytime we have a positive come back on these tests, we send the staff member to the clinic to get a PCR test, which is the more traditional testing for COVID-19. And then if that comes back positive, it's a positive case. But if that comes back negative, it's not. So they do have to be confirmed with a PCR test. So we have had 2 false positives this far. I think we've done close to 1,000 tests now, and we've had 2 false positives. From those testings, as I said, we do have to submit data. So that data is all entered into the WRL within 24 hours of the test being taken. And then that data then gets forwarded to public health to be added in to their system. Our numbers do not count towards the county numbers because they are doing point of care testing, but it does go to them so that they can see if there's any positives or anything like that. And then our negative PCR tests then get connected to our positive PCR tests. So we've been working very closely with KT and her team through this process. We've also been matched with a new lab to do actual PCR testing instead of our point of care testing. So we're working through the process of ordering through that lab, and then we would be sending those out, which is a much easier process for us than entering them all in. So once we get paired with that lab, we will only use our point of care testing in emergent situations when we don't have enough, or if there's a situation that we think someone might be positive, we could test them with that right away and get results in 15 minutes, and then have a PCR done locally instead of waiting for a state lab. We also are working through the ideas of outdoor visits being not sustainable through the cold. Unfortunately, due to our county's positivity rate, we are not able to start indoor visits yet. the federal government did come out with guidelines for indoor visits, but one of the barring situations is that 10% or above county positivity. So as long as we're testing twice a week, because of that maximum or that 10% positivity rate, we also cannot have indoor visits with families. So at this point, we're still limited to outdoor visitation. And at this point, it's getting very difficult, as Scott mentioned, with the snow coming, cold weather. This week has been very chilly. So we are dealing with handling families and making sure that we're still being conscious of their need to visit with their loved ones, but keeping people safe as well in the cold weather. The other thing that we are having more frequently is calls with CMS. CMS is our Centers for Medicaid and Medicare Services. They have had a couple calls with all nursing homes. It's every other week, and then DQA has weekly. They've also last week had a call specifically with just Wisconsin nursing homes, as they noticed the spike in our state as well, and they wanted to make sure Wisconsin nursing homes were prepared, as when this has happened in other states such as New York or Seattle, Washington, the nursing homes were affected when the overall community was affected. So we did have calls with the federal government as well last week. And as of right now, we are not seeing that county positivity rate go down. Last week we were above 11%. And once we go down, we have to test twice a week for one additional week after we go down to make sure it stays down. But then after that, we'd be able to reduce to only once a week testing. So we're really hoping for that as well. Does anyone have any questions for me about COVID? All right. So I will move on to the next item, which is a complaint survey. So we did have a complaint survey last Wednesday, the 7th. Our complaint survey was a one-day survey with one surveyor. She came in, she was only in the building for about an hour, and then she did the rest of the survey off-site via phone conference with myself and the rest of my team. We went into the survey not knowing anything about what she was looking at. She didn't ask for very much. By the end of it, we figured out that she was looking at bathing practices and showering practices, and then skin integrity. The complaint was regarding a resident that had been discharged last April, in the past April, and it was unsubstantiated with no citations. So that all went well. It was pretty clear cut. There was plenty of documentation about the resident receiving showers as well as her skin integrity. So that was all good, and the survey exited about 5:00 p.m. via phone conference. Any questions about that at all?
Just a comment. That sure must be stressful when that happens. So keep up the good work.
Thanks. Yes, it's not a good day when the state walks in, but we have a really good team that knows how to handle it. So it worked quite well. It was smooth, especially now that they do quite a bit of it over the phone. It's a little bit different than when they're in the building all day. All right, and my final agenda item is just census and case mix. I've kind of touched on this a little bit when we went over the referral report, but as I've noted, we have quite a dip in census. We are working on it. We do have quite a few referrals in the works for our open long-term care beds, so those will be filled shortly. We do have a couple from having quite a few deaths in the last couple of months. And then we're working on filling our short-term beds as well. We did see quite an uptick this week in referrals comparatively from the past few weeks. And now that we are able to accept admissions again, hopefully we will be working that number back up. All right. And that concludes everything I had for my report. Does anyone have any other questions for me? All right.
Okay, if there are no other questions, hopefully everyone had a chance to review the vouchers. Are there any questions on the vouchers? In hearing none, we'll get into the financial report. Is Jane with us?
Hi, I just put my video on. Good morning, committee. If we dig right into the financials, the accounts receivable aging is progressing again. I'm happy to say, when you go to the far right column, 3 from the end, you'll see that those middle numbers are at 5%. That's a very good sign. That means that we're processing those monthly claims well, and there's not much residual to get carried over to the long-term aging. In the front end of the aging, the current to 31 to 60 days is at 72% of our aging, which is another good sign that we are making progress. We're continuing to train staff, and it's looking better every month, I'm happy to say. Any questions on the aging? Okay. The pool staff, amount that's paid for pool staff from January to December, you've got your totals and your monthly averages. This past month of September, the total paid for pool staff was $102,133 compared with $168 and $212 the months beforehand. So it was much less. It could be due to invoice processing. I know Paula was gone for a couple weeks, and I believe she signs off on those invoices. So it might get a little larger next month, but so far so good on that. And I think with the hiring that Carmen mentioned, the pool staff will be a little bit less coming forward. So questions on the pool staff to me or Carmen? Okay. The financials. This month, I entered in the COVID payments received from the federal and the state dollars, and the expenses to match that are embedded into the department expenses. We can't pull that out for this report. So if you notice in the actual year-to-date column, you'll see the COVID payments received as $897,644. What we need to do is match up expenses to that in order to keep that money. Otherwise, it needs to be returned. Carmen and I have been working at finding, pinpointing all the little parts of our payroll that have been affected and are claimable. There's a fine line between what we can and can't claim against that almost $900,000. More to come on that. We keep updating and refining our expenses, the PPE, the hourly, the new staff member that Carmen mentioned should be able to be claimed under that because of the COVID testing. In the revenues, you'll see that Medicaid is above average or above the budgeted in our year to date. We're a little bit heavy on the Medicaid and lighter on the private pay. But in the end, it pretty much balances. September was a lower month for census. The month to date was a negative 64,000 as far as what we expected in revenue because of COVID. Although we're a government agency, we cannot claim lost revenue against the COVID money. I believe that's still being talked about at the federal level, but nothing conclusive yet. If we can claim lost revenue, we would certainly be able to claim almost the whole amount, that 900,000. But as of right now, we cannot claim lost revenue. On the expense side, you'll see the nursing services is holding steady, as we discussed with the pool staff. That is shown there. The other expenses are in line. The senior meals continue to be above average. The bistro, of course, is closed. And the bottom line is $213,000 to the good after depreciation and including all the COVID money. So it's a little bit different than you're used to looking at. Even with the COVID money and estimating the expenses, I do see a positive bottom line.
That's good.
Any questions?
Yeah.
Yeah, I have one, Jane. What is the timeline on that COVID money? Is it January 1st, December 31st, or where you have it to have everything turned in?
On the federal money, there's different types of pots of money, but most of them it's December 30th.
Oh,
So that would
okay.
exclude December 31st, but
Okay,
unless they change it, there's been a lot of new guidance. Every month they come out with new guidance. It doesn't seem to be getting any better, the pandemic. So maybe they will change or extend deadlines.
okay.
We don't know.
That is
Thank you.
that is something they discussed on some of the CMS calls, which is a federal mandated program, and that they were looking at what to do going forward, because obviously when the year changes, this isn't going to just magically go away. So they were looking at what to do going forward. So hopefully they extend that time frame.
Okay, thank you.
Okay, and my staff is now working at home. I'm in the office most days, and they're continuing to train on Medicare, Medicaid rulings, and we're doing well.
Good.
That's it.
All right. If there are no other questions for Jane or Carmen, I seek a motion to approve the vouchers and the financial report. Would
So
anyone
moved.
like to?
Supervisor Kinnear here.
Okay, thank you. Is there a second?
Second.
Are there any other questions? And hearing none, all those in favor say aye.
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 Opposed? Carried. Does anybody have anything else they want to bring up at this time? And hearing none, we are adjourned. Thank you, everyone.